In this video we will talk about bone injuries and bone repair process. First, we will talk about bone injury. It is known as fracture. What is a fracture? A fracture is a break in the continuity of bones. There are two types of fractures: simple fracture, compound fracture. What is a simple fracture? It does not produce an open wound in the skin. It is also known as closed fracture. What is a compound fracture? It produces an open wound in the skin. It is also known as open fracture. Now, we will talk about bone repair process. When a bone is injured, the body's healing process is activated. It occurs in a sequence of processes to transform this break into a completely normal bone. Bone repair process. When a bone is injured, blood vessels of the bones are damaged. This causes bleeding. Body forms a blood clot at the injured site to stop the bleeding. Now, new blood capillaries, fibroblasts and osteoprogenitor cells reach the blood clot. Fibroblasts form a granulation tissue, a loose connective tissue, at the fracture site. Osteoprogenitor cells transform into two types of cells, in sequence, to carry out next two processes. First, osteoprogenitor cells transform into chondroblasts, cartilage-forming cells. Chondroblasts form hyaline cartilage in the granulation tissue. This combination of connective tissue and cartilage is called a fibrocartilage callus. Secondly, osteoprogenitor cells transform into osteoblasts, bone-forming cells. Osteoblasts replace cartilage with bone tissue. In this way, fibrocartilage callus is transformed into a bony callus. Lastly, the bony callus is replaced by mature bone tissue, and the fracture is repaired.